But we could get you reports on those usually at a monthly frequency, although if you need it sooner, we could probably do that. And again, the pools that we look at are ER visits. So we've got a daily ER list from the 10 hospitals we're working with. We've got a daily admission list and then a daily discharge list. And again, I think those would be really helpful in managing your patients. And we're trying to make the discharge list currently, it's just the patient's name and a diagnosis and a date, but we're trying to make it to where it would actually say what items were discussed at discharge, like meds, DME, transportation, mental health, behavioral health issues, like all those kind of things. And we're trying to work out a way of building that into our provider portal so that the providers could come on and get it without human contact, but we don't have that set up yet. So right now they got to call either the director of care management or the medical director is good. And the other data source that we have that's really pretty timely and good is pharmacy data, because on there we can track like if it was prescribed, and we can track if they pick it up, and it's got about a 1-day lag on it. So that sometimes can be quite useful, particularly in people that you're pretty sure are prone to not doing what you ask them to do.
Great, thank you. I'm glad you brought up pharmacy data. Okay, we have about 3.5 minutes thank you, gentlemen. I'm going to turn it over to the group for questions. If you want to hit, *7 to unmute yourself. We have time for about two questions for these health plan leaders before we move on to the next item. Anyone have a follow-up question or an additional question that we didn't get to about building relationships with health plans?